My name is Jamie Garcia. I'm one of the interventional radiology consultants at Grantham Hospital. Well, CT scan is a very useful tool for diagnosis. It helps consultants to get to know what the pathology of the patient is and gives you an accurate diagnosis of what's really happening inside the patient, and helps the whole hospital to make a quicker diagnosis and help discharging patients. It's easy to access and reduce unnecessary procedures and unnecessary examinations. Also, it's very helpful for patients because, and for clinicians, because it helps them to get a quick diagnosis of what's happening and reduces uncertainty for the patients and for the clinicians. When you do a CT scan, you expose patients to ionizing radiations, and it's been proven that that can cause certain problems for patients. For example, if you expose very young patients to CT scans, they can develop diseases like cancer in the future. I don't think doctors understand the amount of radiation a CT scan gives to the patient. Most of the results we got of radiation in people are from people who have been exposed to atomic bombs. CT scan is a lot less radiation than that, but like every examination with ionizing radiation can bring some risk to the patient. There are some tissues that are more affected by radiation, like breast tissue or thyroids. One important example is the eye lenses. It is proven that if you have more CT scans of the neck and head, the risk of developing opacities or cataracts in your eyes is higher. This is such an important issue that, for example, me as an interventional radiology, I have to cover my eyes with leaded glasses just to avoid that risk. We also, as healthcare professionals, have to wear leaded apron, thyroid protection, and some of us use leaded caps also to protect ourselves from radiation. The more vulnerable age group to ionizing radiation, I would say, it's the pediatric group and the young patients. So the pediatric colleagues, I think they do a great job because they try to ask for examinations that use ionizing radiation only in very, very specific cases. I'd like to introduce Pete Thurley, a radiologist at Royal Derby Hospital, to tell us about a study on CT scan use and age.
When we examined the rate of CT scan use amongst patients at Royal Derby Hospital, there was a rapid increase from the age of 15 to the age of 19, where there was almost a trebling of the use of CT. This isn't really likely to be due to changes in pathology, but more due to clinician behaviour, with adult physicians much more readily reaching for a CT request form. This is important because these patients are still young and therefore are relatively susceptible to the effects of radiation compared to an older population.
My name is Suresh Babu. I'm a consultant paediatrician at Lincoln County Hospital. I've been working here for the last 23 years. I have to think carefully about putting children through CT scans because I have to weigh the balance of risk versus benefit and what I want to find out from the test. Before I request a CT scan, I need to see whether I could do other imaging, for example, an X-ray or an ultrasound or an MRI scan. And also, before I do that, also talk to radiology colleagues to discuss with them to see which option I would need to go if I have a doubt. And if I'm a junior, I would like it to be escalated to a senior and get more help. Going back to my training days, there was very little training we had in radiology. We used to have X-ray meetings, and that's how our knowledge about radiology came through, and over the years we picked it up. The training has improved over the years, and trainees get exposed to that sort of knowledge. It's important for them to know the risk about radiation, and having an MDT meeting on a regular basis with the radiology colleagues would certainly help to bring focus about the risk of radiation. I know that adult care has hugely different challenges compared to pediatric medicine, but here is a strategy that can cross the specialties. When considering a test, stop and think. What information are you trying to get? What positive benefits will you have from doing an invasive test in terms of needing management further forwards? Have you discussed the risk with a patient? Have you discussed the information you will gain with a person interpreting the test, such as the radiologist? Is there a way of getting same information in a less invasive manner?
Of course, there's risk in not imaging a patient because an important diagnosis could be missed, and sometimes patients who are very anxious may prefer the certainty of a CT scan result regardless of any radiation involved. These are complex issues. Therefore, as clinicians, it's important we understand the risks and benefits of performing an investigation on our patients. and that we are aware of the different options available to us.